Hello, our viewers. Thank you for watching Coherent TV. And this is another episode of the Big Topic Show with your host, Emanuela. And today we are yet to delve deep into another topic that is, how to bring in access to post-abortion care, given the restrictive setup or within the country and also the resource limits within our country. So today we're having a distinguished guest with us who will be sharing with us a lot. And before we go forward with our discussion for today, let's get to know who he is and we get to go deep in our topic of today. You're most welcome, sir.
Yeah, thank you very much. My name is Dan Kaye. I'm an obstetrician and gynecologist, that is women doctors. Been working for over 30 years, 25 of them, more than 25 of them as a gynecologist, obstetrician. I work at Makerere University for the last 24 years. I've been working in the Department of Obstetrics and Gynecology. Yes, I'm very glad to share with you this morning.
Well, you're most welcome, Doctor, once again. And just like I had said earlier on, we will be getting to discuss about the access to post-abortion care, given the restrictions in within our country, according to the legal framework of provision of abortion care services in the country, and then given the the limited resources when it comes into availing these services. Well, Doctor, just to start with, I believe someone out there may be wondering what post-abortion care is. Could you kindly elaborate a little bit of what post-abortion care is?
Yeah, thank you very much. Post-abortion care comes from the three words post, abortion, and care, which means that this is a care that is needed by a woman who has had a pregnancy that has not reached the stage of being a baby being born, and this pregnancy comes out by whichever way it does. So some of these pregnancies may come out because spontaneously, that is on their own, maybe because the mother has had an illness, after an accident, if the baby is not formed well, and it comes out on its own. But we also know that there are some situations when a woman, for one reason or another, decides that she has got a pregnancy when she's not prepared to keep it or to continue with it, and somehow uses some method herself or with aid of some other people to say the pregnancy should not continue and gets rid of it. Now, in such a situation, the woman can get some complications. Now, these complications require that that kind of person gets some assistance, and this is what constitutes post-abortion care. Post-abortion care refers to the care that a woman in such a situation gets and includes the emergency management of the complication that the woman may have. Remember, if the pregnancy has come out because of some illness, then the care also includes management of that kind of illness. For example, if a woman has had malaria, has had a fever, and this leads a pregnancy to come out, then part of the care includes managing that condition that has led the pregnancy to come out, in addition to managing the complications, which we know include bleeding. We know there might be some infection if some products remain. We know the woman may be affected psychologically or emotionally. So that kind of support also constitutes post-abortion care. But in addition, if this pregnancy was not prepared for, was not planned, the woman may require care that prevents such occurrence of an unplanned pregnancy. So that means the woman needs to get contraception, that is family planning services to prevent getting another pregnancy when she's not prepared for. That also includes part of post-abortion care. And lastly, the woman may have some other concerns, maybe some infections, maybe she didn't have means of stopping a pregnancy because maybe the partner, they were not good terms with the partner, there was what we call violence within the family, or sometimes even the pregnancy may come out because structurally the uterus is what we can say weak, that it can't hold a pregnancy in the way it is formed. Now, that also needs to be managed. So that lastly, that kind of service is what is called linkage to other reproductive health services. It seems broad, but it can be identified that any other needs that the woman have relation to her concerns related to reproduction can be managed as part of post-abortion care. So post-abortion care is not restricted to managing abortion complications, but includes support and counseling, includes post-abortion contraception. It also includes linkage to other services which might need within the community, not necessarily at the health facility.
Well, thank you so much, Doctor. That has been a broad one there, and I believe someone out there could have gotten a clear picture of what post-abortion care is all about. Now, coming in back to post-abortion care itself, with the legal context of Uganda, is it acceptable because someone out there, because looking at the statistics, that the uptake of post-abortion care among young women or women of reproductive age is actually low. So I'm wondering why that is. Could it be because that it is being restricted within the country, or what? Maybe there is, could you just maybe clarify if it is allowed or it is also restricted? That's why the rates of access to post-abortion care is a little lower.
Yeah, maybe let me first elaborate on what she refers to as restriction of post-abortion care. What is restricted is that a woman should not have a pregnancy and just decides to have it removed on her own without any reason, any medical or other reason which is permitted by law. Maybe to clarify on that, a pregnancy can only be removed if at the determination, what the law allows that, at the determination by health workers, then this pregnancy is going to affect the woman's life. Maybe somebody is very sick with a condition that cannot coexist with the pregnancy, then the law somehow permits a woman to have it removed on her own, or with support of health workers. Another situation is when the baby is not formed well, what we call congenital abnormalities. Abnormalities where structurally the baby cannot continue to be alive even if it reached a time when it's born. Now, it's only those two situations that the law permits, but also the law can permit in some, the practice, not the law, permits that in some situations socially, if a woman conceived out of an unwanted relationship, for instance, after rape, after defilement, after incest, that is relationship between very closely related individuals, then socially that pregnancy may not be accepted. Much as the law does not allow, socially some people or many people believe that that pregnancy should not continue. So there is a difference between what the law permits and what is socially acceptable and allowed to be permitted. But now, the important thing to remember is that most of the pregnancies that come out on their own usually don't have very many complications. But or whether the pregnancy has come out on its own, or whether somebody has intended that the pregnancy should not continue and gets some, or removes it or gets it removed with permission, with support of others, then all these individuals need post-abortion care. So going back to her initial question of whether of access, the reason why everybody requires post-abortion care, and it should be assessed by everyone, irrespective of which circumstances led the woman to have the pregnancy come out. So the law permits and allows every woman to access post-abortion care. What the law may not allow is how to get the pregnancy removed, what somebody may broadly call abortion care. But post-abortion care, that is after the event, every law, and it's a good practice, even from a human rights approach, that these women require support, require help, require all the care needed. So post-abortion care is allowed universally, whereas abortion care may be restricted, like I said earlier.
Well, it's quite interesting that you're bringing it that the law accepts post-abortion care to be provided regardless of how the person terminated. So, meaning indirectly, the law is allowing people to go and abort in any way that they want, and then they can be able to come and access the post-abortion care.
No, that is one way, that's maybe one way of looking at it, but that's not necessarily right. In that, if you restrict post-abortion care, the majority of patients who get an abortion, that is, or what in late term they may call a miscarriage, when the pregnancy comes on its own, this would be restricted from getting services. So because of that reason, post-abortion care is universally allowed, permitted by law, acceptable socially, and it's a good practice when you consider it from all angles to be provided to everybody. What may be restricted is intentionally one deciding to terminate the pregnancy. But still, even when you consider that, it's a good practice, because by the time somebody decides to terminate a pregnancy, maybe they're forced by circumstances beyond their own choice. And it will be a good practice to ensure that they go through this event, much as it's an unfortunate event, not allowed by law, not allowed socially, not acceptable in some circumstances, they go through it safely. So that in many health facilities, and from the viewpoint of the organizations like the World Health Organizations, it would be a good practice that these women can access what is called safe abortion. That is, services provided by a trained person in a safe environment using the right approaches should be provided so that they get a safe abortion. So from the international point of view and from the World Health Organization, even safe abortion is allowed. But from different countries' rulings or what they permit in form of laws, for instance, in Uganda, it's not permitted that anybody who wants can access safe abortion. So that is the distinction between safe abortion and post-abortion care, in that safe abortion is something that is good to have, but many people cannot have it. But management of post-abortion care should be given to everybody, and is allowed by law and by all international organizations.
Well, thank you so much, Doctor, for having clarified on that. Moving on, we've talked about post-abortion care and what it encompasses. Now, I would love to know from you, why does it matter to a woman or to a young girl, and probably how is it important to their families, the community, and could there be any practices or any examples of how it has been of good help to the woman or the community at large?
Yeah, thank you very much. Like I said, some of these pregnancies come out on their own from a reason that it may be a medical problem. Maybe somebody has high blood pressure, has diabetes, has any other medical condition. Maybe the uterus is not well formed and it's what we'll call structurally weak. These people need help right from the beginning. So it will be important that if unfortunately these kind of people got an abortion, they definitely a spontaneous abortion, an abortion that comes out on its own, they definitely need services, including post-abortion care. But even those individuals who intentionally decide that the pregnancy should not continue, they can be looked at as patients who need help. So they also need post-abortion care, because one, this will be an opportunity for you to link them to care, to the post-abortion care. Like I said at the beginning, it's more than managing the complication they have. It includes linkage to other services. It includes opportunity to offer post-abortion contraception, and it provides an opportunity to provide counseling and emotional or psychological support to these individuals. So it's a good practice that everybody should have post-abortion care. The other reason is that because of the restriction socially and by the law, abortion is taken as if it is something that is not allowed, something that is bad. something that should not occur. Yet naturally, it happens. So there is a lot of stigma. And if I can say stigma is a feeling where individuals are made to feel that they are less important, they are wrong, they are doing something unacceptable. And it's the reason which drives on people to do abortion in hiding, clandestinely, in hiding. And it's because of this that they get what would be called unsafe abortion, which leads to the complications. So the stigma drives the abortion complications. So when you provide abortion care and you indicate that irrespective of whatever circumstances, people who have had an abortion need care, it's a good practice that even those who decided to terminate the pregnancy of their own will not suffer severe complications. Or even if they have had, they will know that they are welcome at any health facility and they will be given help. And the way the law looks at it, in that in most cases, even the law looks at them first as patients, not as some people who have broken a law or people who have done something that is not permitted by law. Because for you to have in law, you need somebody to complain, to present to have a complaint. A complainant must present the case. So if the patient has not presented the case, the healthcare provider or relatives have not presented the case, then it remains, abortion will remain a medical problem. And because it's a medical problem, then the medical problem will ensure that the abortion complications are managed and death and severe complications would be prevented from happening. In addition, the emotional and psychological support given will ensure that the individuals requires fully, because we don't look at an abortion as a merely medical problem. There may be social or underlying factors that drive people to lead them to terminate a pregnancy. These are also partly addressed by post-abortion care. And so that is the importance of having post-abortion care universally available to everybody.
Well, now looking at, if I got you right, I heard you talk about stigma, and I know it's one thing that maybe probably affects in women from accessing the post-abortion care services. Now, I would love to know from you, what practical steps do you think can be taken to make sure that post-abortion care is made available and affordable to the women who may be in need of it?
Yeah, thank you very much. Now, the most important thing is to make sure that there is a discussion in the community and at all levels that abortions can cause some danger to women. But this danger can be prevented if post-abortion care is made universally available. So there should be a discussion at all levels within the community, within the family, in all media, like newspapers, on platforms, social media platforms, on radios and TV, that abortions can cause complications, but these complications can be prevented using post-abortion care. So that discussion should be there. Then at the same time, if you say that post-abortion care is important and is helpful, then you must make sure that you mobilize the community to seek it. So when you inform people that in case they know somebody who has an abortion complications, even individuals who have had an abortion, they should go to healthcare providers. Thirdly, you need to make sure that the health workers who should receive these patients and offer them the post-abortion care are sensitized. But sensitization is not enough. You need to train them to build their capacity to manage not only the abortion complications, but also provide the full spectrum of care, the emotional support, the linkage to other services, and post-abortion contraception. And lastly, you must make sure that you provide the necessary equipment, the necessary supplies, which will ensure that these services are provided in a comprehensive manner. And maybe finally, you may need to look at some of the components of the law. For example, if it says that many people believe that if somebody has had an abortion, because the law does not allow, then they should not be helped. So one needs to directly address abortion stigma. And this requires that you talk even to law enforcement agencies like prosecutors, police, to tell them that these are primarily patients. Before they look at them as people who have broken any law. Let them at least first address the abortion complications. And in that way, they'll make sure that people who have had an abortion will go through it safely. Even if they get complications, they have a chance of surviving the abortion complications. So those are the several ways in which one can ensure that post-abortion care becomes important and can save women's lives.
Well, thank you so much, Doctor, for having elaborated more on that. And I think we're still continuing with the big topic show, and we're yet getting to know how best post-abortion care can be extended out to women in need, given the restrictive laws that we have within the country, and then the resources that are limited for us to be able to provide these services within our communities in Uganda. And we're still continuing. Let's go out for a short break, and we're going to come back and continue with this episode of the Big Topic Show. Don't go away. Welcome back from that short break. And if you are just joining us right now, don't forget to follow us on all our social media handles and be able to get more information on what the kind of work that we do and our other programs that we've been able to host. And yes, we're still continuing with the Big Topic Show. I am still your host, Emanuela. And we were continuing talking about how best we can get to avail post-abortion care services to our women. And I would love to know from you, as you work with a WOGU doctor, what have you been able to do to ensure that post-abortion care services are made affordable and accessible to the women?
Yeah, thank you very much. Maybe he has given an abbreviation of WOGU, which stands for Association of Obstetricians and Gynecologists of Uganda. This association has been there now for the last 40 years, and most of our work is mainly involved in capacity building for healthcare providers, especially in reproductive health. We don't directly provide services, but we work with the Ministry of Health to develop management guidelines and protocols for caring for patients. We advocate for better services, and we also are involved in training different service providers. So at the WOGU, our role has mainly been in training. We have trained over 4,000 healthcare providers who are midwives, doctors, medical clinical officers, and obstetricians in safe ways of providing post-abortion care. The other way has been in advocating for standards in terms of policies, in terms of services, in terms of equipment and supply that are needed by different health facilities and healthcare providers. Thirdly, we provide some of the equipment to provide post-abortion care. For example, where we say post-abortion care safely requires some equipment that can be done for example, manual vacuum aspiration, whereby somebody can be provided care without needing anesthesia. They don't stay long at a health facility. So we provide some of these, including the medications that are given to provide safe abortion. We also provide medications for family planning to different service providers. And lastly, we have tried to make sure that we work with Ministry of Health to change the policies, especially regarding which providers can provide safe abortion. Initially, it used to be only doctors provide safe abortion or even provide post-abortion care. But nowadays, we advocated for a change in the scope of practice by working with the professional councils like Uganda National and Midwifery Council, the Uganda Medical and Practitioners Council, and also the Allied Health Professional Council, so that they change the scope of practice, that these providers can also, midwives, medical clinical officers, and other people can provide components of post-abortion care within those that are permitted by the law, by the regulators. So in that way, we increase access to post-abortion care. But there is also another way in that we don't only work with the people already in practice, but we work with health training institutions. For instance, nurses and midwifery training institutions, universities, and institutions that train medical clinical officers and other service providers, so that they include the scope of how to provide post-abortion care, how to manage these patients, how to provide the needed counseling, how to provide the necessary linkages with the community, so that the curriculum of these institutions are changed. Of course, when you train people in pre-service, you achieve much more than if you waited for the people to complete training. We also work with other ministries, for example, Ministry of Gender, to ensure that they change some of the policies. For example, those which would require young people who are not yet 18, adolescents, to be able to access services without needing the parents to be available. Of course, there is a law to that, which the law says that they should be 18, but we know many of these people can get a pregnancy which may come out intentionally or not, and these people need services. So what we want to change is that the Ministry of Gender can change some of the policies which require that these adolescents can be able to access services. We also work with the Ministry of Education on the issue of sexuality education and health education to people who are in school. In that way, you warn them about the dangers of relationships that could lead to unplanned pregnancy, also managing complications like sexually transmitted infections that could eventually, in case somebody finished school and conceived, these could be some of the factors that lead to spontaneous abortion. So our work is multi-pronged, multi-sectoral, to ensure that eventually all individuals who would like to have post-abortion care can safely have it under different circumstances. We also work with other civil society organizations. For instance, our host here, Coherinet, we work with them, and with many other organizations like the Center for Health and Reproductive Health, to Clearham, and there are so many. So our role is to make sure that we work together as advocates. For those who are providing advocacy for access to post-abortion care, we work together so that we can communicate the information about the need to have post-abortion care universally available to everybody. Then for others who are in organizations like those deal with law, so that these can work to change the legal environment, the restrictions on access to post-abortion care. Then there are community organizations that deal mainly with stigma, abortion stigma, to make sure that abortion is no longer taken as something that is evil at community level. So we work with them so that we can have open discussions about abortion, so that we make people look at abortion as a medical problem where people need help, rather than something that is evil, so that they should be ostracized or they should be ignored, yet they need help after getting abortion complications.
Well, doctor, you've again hinted on stigma. So now, so many women get to fear being judged to access the post-abortion care services. How best can the various people in the community, whether it being the families, whether it being the healthcare providers or the community at large, be able to help change the conversation around post-abortion care access?
Yeah, thank you very much. The most important thing about the discussion is to look at abortion not only from a judgmental view of saying abortion is right or wrong. It's neither right or wrong in all circumstances. Also, looking at it from the legal angle, is it legal or not? Because there are situations where abortion is permitted by law, but other situations it's not permitted. So the most important aspect to look at it is to ensure that irrespective of how the woman has got an abortion, these women need help. They need support So the conversation should be about reducing that feeling of negative judging of individuals who have had an abortion. And then secondly, trying to link these people to where they can safely get post-abortion care services. After all, this post-abortion care is allowed by law, is a good thing to do, it can save lives. So the most important thing is to have open discussions, and in that way we can be able to reduce abortion stigma, and so make sure that women who have abortion complications can access post-abortion care.
That's a good one. Doctor, now I would love to know from you, making post-abortion care available or affordable is one thing, but again, sustaining it is another. So how best can, the government and the private partners like Awogu and Cohernet be able to ensure that these critical services are made sustainable within the communities or within the country?
Yeah, thank you very much. The most important thing would be to have a multi-pronged approach, a health system approach. And one of the most important things is human resources. Like I've already said, human resources, the service providers need to be trained, not only in service, but also before they complete their training, so that they know about the need and also have the skills to provide post-abortion care. Then we need to provide supplies and commodities. We also need to change policies which can make sure that individuals can be able to access post-abortion care services. Then finally, we need to make sure that the community, all different people in the community, irrespective of who they are, they can have a role to ensure that services are obtained. For instance, you can say the church the religious groups or churches may negatively judge patients who have had an abortion. But not all of them are judgmental. Others look at these individuals as their churchgoers, as their indiga, as their sheep, as people who need help. So once you work with them, they can be able to mobilize the help needed to address stigma, or the information that will lead these people to seek post-abortion care. Or some of them provide clinics or medical services. They can be able to have a clinic that provides post-abortion care to women who would need it. So the approach to making universally available post-abortion care requires that different providers, different individuals can identify what role they can play, and if they are mobilized and informed to understand that post-abortion care should be universally available because it saves life, then they can contribute in different ways where they can to make sure that it becomes universally available and can save lives.
Well, as we are coming into the closure of our program of today, it's quite interesting that I really didn't want us to end, but then, time is not on our side, and we obviously have to close up for today. But then hopefully we'll have a lot more time to talk more about provision of post-abortion care and the rest of the things that are encompassed in post-abortion care. Well, as we are closing today's program, if you were to say something to the policymakers within Uganda and the public at large on post-abortion care, what would it be, and why is it now?
Yeah, many women, what I would say that many women at some point in their lives will need post-abortion care. Post-abortion care saves life. And if it's not provided, women have complications which are long-term or short-term, or even death. So my parting message that post-abortion care should be made universally available for everybody. And then different people, whether they are religious leaders, healthcare providers, or policymakers, may have a role to play to make sure that post-abortion care becomes universally available for it to be able to save lives.
Well, thank you so much, Doctor, for having given us your last words. I believe whoever is concerned about this have heard it clearly. And just to remind you that this show has been sponsored by Anti-Kaki Toll-Free Helpline, and it's a helpline that provides reliable information in regards to sexual reproductive health, and you can reach out and get to know whatsoever that you want in regard to your sexual reproductive health. And don't forget to follow us on all our social media handles. In case of anything, you can always keep on leaving in your comments whatsoever that you would love us to talk about the next time. We will be able to find it in the comment sections and be able to give out the rightful information to you as well in our next episode of the Big Topic Show. I am still your host, Emanuela, and thank you for watching.